We have this last session here that really not supposed to be about me, but sort of more sort of hearing from those who didn't talk or who didn't get a full chance to talk as well. I think one thing that bringing all of the fabulous panelists and the presenters together, our interest in doing this was to spur this conversation and to hear more about ways in which data disaggregation can be useful, and I think we've heard a lot about that, and what people think future steps might be, or where, again, those of you who haven't had a chance to speak and want to sort of lend some of your thoughts on what you've seen today and what you think might be what you consider a priority. I think it's useful for the rest of us to hear, those of us who have organized this and who have, sort of been thinking about it ourselves, but to hear sort of outside perspectives. So if you want to just, please come up to one of the mics and let us know. Yes, please, Robert. Oh, and introduce yourselves as well, please.
Hi, everyone. I'm Robert from the Virginia Department of Health. So one of the things that I'm taking away from this is I work a lot with population health data. That's the division I work in, is we do a lot with community health assessments. All of our health districts and health departments are encouraged, kind of voluntold to get accreditation, which means they have to conduct a community health assessment, as well as all the nonprofit hospitals by ACA tax regulations also have to complete them. And so this is really important because that means we're trying to get a lot of county data. In Virginia, independent cities are also counties, so Charlottesville, Richmond are counties for Virginia. So here, listening is very helpful because we're trying to do better at making sure data is available at a county level, and then trying to also do some race from there, but seeing that that's insufficient and looking beyond just the categories that we have, but also trying to see how we can take sort of these ideas further. I thought the mortgage data was very interesting. How do we use that for health equity and health disparities? 'Cause that's something that we're very interested in, but it's also can be difficult with a lot of this data as presented at a nationwide or state level. How is that helpful for communities? And that's one of the things that I heard a lot is I would look at the data sort of from an academic perspective at a state level, and then I would take that to the people that would come to the meetings or who are representing hospitals, and they're like, this isn't very useful for us because it doesn't represent our community. It just represents the state or the nation. And so how do we make that useful from allocating health resources or focusing everything we do? Because there's a lot of money that's spent across this, I'm sure, across the nation, not just in Virginia. But it's a big question for us.
Beyond just having the mortgage coverage itself, it indirectly informs other questions around financial well-being and
I've looked at it by census tract. I might follow up with you. Part of the thing we also encounter is capacity. These are great issues to look at, but if I'm the one person who has access capacity to do experimental research on this thing, I need help.
Yes.
Any other thoughts, comments?
It's slightly peripheral, but I'm extending on something that David said. It's a thought that I want to leave you with. It's a policy issue, so you folks would be much better positioned to consider this. I think in the very near future we're going to discover privacy is over. Because there are two kinds of breach of privacy. One is linking records, re-identification, all of those things. The other thing is a probabilistic linking of privacy. In other words, somebody can look at my digital behavior. I just don't mean only social media, but also my banking, my financial services, my credit card behavior, and plays with very, very high accuracy. They can say, you're probably living in Baltimore between 39th and 48th Street on St. Paul, you're a registered voter, and you contributed to candidate John Doe. I think that with machine learning, anybody that is between the age of 12 and 30 today, there are very, very accurate profiles. Going forward, as those digital natives become the majority of population, I think privacy, personally, I think privacy is over. Should we instead, on a policy level, this is the question, try to stop and put meaningful fetters, meaningful constraints on how this information can be used?
Thank you. That's exactly the kinds of thoughts that I think we're interested in thinking about, sort of, as opposed to being overly concerned about privacy. Are there ways in which we create the ethical ways in which the data gets used, or something like that?
Or it's much easier to stop people from denying credit to John Smith because he supported some candidate or because of his race or his religion or his lack of religion, than to say that I will stop you from knowing about John Smith. That's going to become very, very hard.
Yeah, that's very interesting. Yeah. Great. Thank you. Richard. Richard and someone else?
So, I have spoken before, but it's perfectly timed, of course, this conference, because the Census Bureau just brought out the latest inequality numbers. And so there's been a theme of inequality and inequity here, but we know that inequality in the US is 0.485. That's the Gini coefficient, a single number summarizing income inequality for the whole country, right? It's like the opposite. It's the ultimate aggregation. And so it's perfectly timed to do disaggregation. One of the things that occurs to me is, and it's a chance to plug a colleagues' work, is as we've got more and more complexity, we disaggregate and disaggregate and disaggregate, you get to the point where the ultimate intersection, I was really thinking about this during Shabab's, another disaggregation. I think a lot about class and gender, and then you've had race, and then within race, and then gender identity, sexuality, etc., etc. In the end, the ultimate site, the ultimate disaggregation is the individual. And I think what that leads you to is, first of all, have the confidence to disaggregate, knowing that we can aggregate back up again in order to mobilize resources, because that's a fear. But secondly, that leads us to a real focus on the lived experience of those individuals. And so where I think a lot of this highly accomplished data work leads you is to a renewed appreciation for the value of qualitative data alongside quantitative data. I'm very impressed with the way that some of the big data people, including Opportunity Insights, Raj Chetty's team, are working with people like Stephanie DeLuca when they're looking at housing. And you're seeing these teams now where the data takes you to a place where the quantitative data basically ends up saying, look at these differences, aren't they interesting? And you can't answer the question as to why those differences exist unless you go and talk to the people. And so there's this, I think that the whole disaggregation move might actually provide more opportunity for better collaboration between quantitative and qualitative researchers to answer these questions, because they're getting so close to lived experience. We're just not going to do it from up here anymore. We've got to do it both ways. So that was one of the things that occurred to me I wanted to share.
I also wanted to talk about, in the area of protections, like you're saying, if we can't control privacy, at least maybe we can control the protections. I think that it's important to consider not only protections for individuals, but protections for communities. That's particularly an issue for us because tribal nations want to protect their data, but it may be another issue for other communities, because it is possible there have been many times in the history of research where communities have been stigmatized due to research that's been conducted. And as we do more data disaggregation, more communities are identified and potentially stigmatized, or other things can happen to them. So I think this issue of privacy versus protection versus access, those are all really important issues. The other thing we haven't talked about today is the All of Us research program. I think that there are some serious issues around data protections, especially for tribes, as basically the All of Us research program is recruiting people to 1 million diverse people to be entered into a study where basically they'll have a data set and researchers can apply to do any kinds of studies they might want. And right now I don't have confidence that the review process at the All of Us research program is going to protect the interests of tribal nations or even American Indian and Alaska Natives in general. So we have been had a lot of conversation with the All of Us research program. It sounds great. Yeah, we're going to do all this research that's going to help all these diverse people, but diverse people know that research can be harmful. And so the All of Us research program has put some organizations in some very difficult places by funding those organizations to help with recruitment. So they're in sort of a conflict of interest around whether they can talk about the negative issues around that. But we're not funded, so we're free to talk about it. And we have tribal consultation since it's a federal program. But I encourage people to look at that with the lens of protections around individuals and communities, and what kind of disaggregation could result from that program that's good, and what kind of disaggregation could result from that program that's harmful. The other thing I think that we need to be cautious about is the whole premise of the All of Us research program is that genetic research is going to be the solution to finding therapies that are going to help us in a better way. But I'm not sure that that is the only solution. And, there's a lot of harms that can come from that. So as we think about data disaggregation and protections, we right now have a large federally funded research program that has very little oversight in place that will protect vulnerable populations and small populations.
Outside of what we were discussing, but I'm particularly interested in the study of undocumented immigrants. Undocumented immigrants are like a hidden population, right? To identify an undocumented immigrant, you need to do like backwards induction, right? Count the number of people residing in a particular zip code, then use tax data and subtract it from the number of residents. And so you get like a noisy estimate. But if you, it's a big population. It's a population that is right now is experiencing a lot of threats coming from federal government, etc. But if you wanna examine their characteristics, the effects of different shocks, whatever, how do you identify? So.
That's a big question that everyone's concerned about.
Yeah.
I think there's concern for being able to identify them and round them up and remove them, right? It's clearly part of the double-sided issue here. But please.
Yeah, I think that's the double-sided issue. There's a nice, I think, letter by Ann Pebley in AJPH on should we collect or not, particularly on documentation. We looked at years in California Health Interview Survey. We've been asking a question on whether you have a green card or not. So we ask, are you born here? Are you a citizen? Are you naturalized? And then if you're a non-citizen, do you have a green card or not? The item non-response has been pretty good. I think it's less than 5% through the years. It was a dissertation by one of my students. But then there were 2 years where we collaborated with some immigrant researchers and demographers like Frank Bean, Karthik Ramakrishna, David Fitzgerald. And so we added some questions on visa status. So we didn't really get documentation, but we got visa. Are you a tourist? Are you, are you tourist, work, A lot of stuff I regret not putting refugee, because refugee is really important. And then, is it still valid? Did it expire? So based on those questions, you can kind of get at documentation. Some researchers have used our data, and my student did some, looked at some of the other data that's done by oh gosh, I can't remember, but by Pew, I guess, and it's Jennifer Van Hook. So it's the for Mexicans, the no green cards is about 95%. Again, there's really no gold standard, right? So, but about 95%. If you're talking about Mexicans who say they don't have a green card in California, that have been here for X number of years, that's a good approximation. And some scholars have used that, like Arturo Vargas Bustamante have used that, Alex Ortega have used that as undocumented. It's not that great for Asian immigrants, right? So Asian immigrants, you're not going to get the no green card status. So it really differs. And then there's probabilistic modeling. A researcher at our center has done some kind of assignment, Nadi Parat, on documentation. But at the very least, again, you have to explain to the respondent that we do not work with immigration services. We do not work with, it used to be INS, now it's ICE, I think. We do not report this. We do not report any of this data to the government. It also helps we're not a non-government data collector. I mean, it's on the flip side, we don't get the 98% response rate of the American Community Survey, because you're mandated to answer because we're the government. But it's the non-response isn't bad. So just a question on green card, non-green card citizenship, I think I would endorse in some surveys.
So I want to thank everyone. It's 4:15. Let it be known that Randy concluded on time. I respect people's time, but I just want to thank everyone for being here. All of our presenters, our discussants, our panelists from near and abroad. I want to thank Tina again for allowing us to have this with the Robert Wood Johnson Foundation, which has been incredibly generous to us, but also to others that have been here. And we will, just for your own information, we'll provide, for those who allow us to provide their talks, their PowerPoints, on a web page here at Brookings, so that you can get a bunch of these materials. I'll have a write-up summarizing what we've seen here. And, I hope many of us can stay in touch with each other, because I think we've seen a lot of really interesting overlaps in our interests. And have a great rest of your afternoon. Thanks to all of you.
And let me also say thank you to Amita and Randy. It's a huge amount of work, really, really big day. Thank you so much.
Thanks for watching. Be sure to like and subscribe for more videos from Brookings.